first pelvic examination can feel intimidating for many people, especially if they are unsure what will happen during the appointment or why it is necessary. Understanding each step of the process helps reduce anxiety and allows you to feel more confident and prepared. A pelvic exam is an important part of routine reproductive and general health care. It helps identify infections, assess the health of reproductive organs, address symptoms like pain or abnormal bleeding, and when appropriate, include screening tests such as a pap smear. This video guides you through why the exam is done, how to prepare, what happens during the procedure, and what to expect afterward. A pelvic exam is usually recommended when someone becomes sexually active, experiences symptoms such as discharge, itching, or pelvic pain, or reaches an age where cervical cancer screening is advised. Before the examination begins, the healthcare provider usually starts with a private conversation. They may ask about your medical history, menstrual cycle, sexual activity, past infections, and any symptoms you may be experiencing. This is also your opportunity to share concerns, ask questions, and explain anything you feel nervous about. The provider's goal is to make the experience as comfortable as possible, and everything you discuss is confidential. The physical part of the pelvic examination typically begins with the patient changing into a gown and lying on an examination table. Your feet are placed in padded supports called stirrups, allowing the provider a clear and gentle view of the pelvic area. They always explain each step before doing anything. The exam usually involves three main components: an external examination, an internal examination with a speculum, and a bimanual examination. During the external examination, the provider visually inspects the vulva, looking for signs of irritation, swelling, discharge, or skin changes. This part is usually quick and painless. After this, the internal examination begins using a device called a speculum. The speculum is gently inserted into the vagina to allow the provider to view the cervix and vaginal walls. You may feel pressure, but it should not be painful. Taking slow, deep breaths and keeping your body relaxed can make this step easier. If a pap smear or sample is needed, a small soft brush or spatula is used to collect cells from the cervix. This may cause a mild sensation, but it is usually over within seconds. Following the speculum exam, the provider performs the bimanual exam, which involves placing two gloved fingers inside the vagina while gently pressing on the lower abdomen with the other hand. This helps assess the size, shape, and position of the uterus and ovaries. You may feel some pressure or fullness, but it should not feel sharp or painful. If something does hurt, it is important to say so immediately, because good communication helps the provider ensure your comfort and properly evaluate your symptoms. After the examination, the provider will leave the room so you can get dressed. They will then discuss the findings, explain whether everything looked normal, and review any test results that will be processed later. If you had a pap smear, the results are usually available within a few days to a couple of weeks. The provider may offer advice on sexual health, contraception, menstrual concerns, or any symptoms you mentioned earlier. It is normal to feel slightly nervous before a first pelvic exam, but remember that it is a standard and routine medical procedure performed with care and respect. The provider's goal is to support your health, answer your questions, and address your concerns with sensitivity. Most people find that the experience is much easier than expected once they understand what will happen. Being informed, communicating openly, and giving yourself time to adjust to the process all help make the first pelvic examination a positive and empowering step toward taking control of your reproductive and overall health.